issue that really grabbed me as urgent were issues related to population.
In 1998, Dr. Zabin became the founding director of the Bill and Melinda Gates Institute for Population Control.
Dr. Zabin became the founding director of the Bill and Melinda Gates Institute for Population Control.
We see a lot of things that are going very well, things like reducing childhood death and First, we've got population. The world today has 6.8 billion people. That's headed up to about 9 billion. Now, if we do a really great job on new vaccines, healthcare, reproductive health services, we could lower that by perhaps 10 or 15%.
Now, if we do a really great job on new vaccines, healthcare, reproductive health services, we could lower that by perhaps 10 or 15%.
The problem is that the population is growing the fastest where people are less able to deal with it. So it's in the very poorest places that you're going to have a tripling in population by 2050. And so their ability to feed, educate, provide jobs, stability, protect the environment in those locations mean they're faced with an almost impossible problem. Here we can see a chart that looks at the total world population over the last several hundred years. And at first glance, this is a bit scary. We go from less than 1 billion in 1800, and then 3, 4, 5, 6, and 7.4 billion where we are today is happening even faster. So Melinda and I wondered whether providing new medicines and keeping children alive, would that create more of a population problem?
And what the developing world does not need is more children.
And I think that was the biggest aha to Bill and me when we got into this work, is we asked ourselves, of course, the same hard-nosed question you'd ask, which is, if you get into this work and you start to save these children, will women just keep overpopulating the world? And thank goodness the converse is absolutely true.
This is a very important question to get right, because it was absolutely key for me. When our foundation first started up, it was focused on reproductive health. That was the main thing we did, because I thought, population growth in poor countries is the biggest problem they face. You've got to help mothers who want to limit family size have the tools and education to do that. And I thought that's the only thing that really counts. Is spending $1 million on that last 3 months of life for that patient, would it be better not to lay off those 10 teachers and to make that trade-off in medical costs? But that's called the death panel, and you're not supposed to have that discussion.
But